provide concern for people, because Paul also tells us that we do not just care for people within the church, but that we should also do good to everyone. And I think a helping ministry is a way to do good to people in society, because we know that people are hurting in their own pains and stress, and people who are married have marriage problems, people who have children struggle with family life issues and difficulties in relationship within the family, and there are those who are out there struggling to live with stress in their work. And I think in this sense, if we can offer them a helping hand to cope with life's problems, I think it is very important that the church should respond to such needs in the world.
Counselling and Care Centre, or CCC, is a non-governmental, non-profit organisation dedicated to providing quality counselling services, counselling training and consultation to professionals in the mental health and social services. CCC has become instrumental in advancing the field of counselling in Singapore. Established in October 1966, CCC is the oldest counselling centre in Singapore. We pioneered numerous programs which were first in paving the way and laying the foundations of the practice. The counselling fraternity in Singapore today is synonymously associated with the Counselling and Care Centre.
When I first heard about the Counselling and Care Centre, it was originally called the Church's Counselling Centre. It was a joint project by the St. Andrew's Cathedral and the Wesley Methodist Church. So the person who was appointed as the director of the Church's Counselling Centre was Reverend Gunnar Tellman. It was a very exciting time because counselling was very, very new to Singaporeans. Most people, if they have marital problems or family problems, they would not even know that there is a counselling centre that is available.
I was involved with the SOS as a volunteer, and I got in touch with Dr. Gunnar Tellman, who was the CCC director, because the CCC staff, Gunnar and the CCC, are very much involved in the recruitment, training of volunteers and in the running of SOS too.
I want to give credit really for Anthony Yeo and even a few of the other people around him at that point in time. I think they saw that actually there was a place for counselling in the midst of what we're developing in terms of the social work practice, because there is a place for counselling whereby people really need good advice and counselling one-to-one or with a family in really to sort out some of your thoughts and emotions.
The first national director, the first local person to take over was Anthony Yeo. And Anthony Yeo also had tremendous foresight. He knew that there was going to be a lot of potential for the growth of marriage and family counselling services in Singapore. He went over at that time to the US of A to do his master's training. And so when he came back, Anthony was just so enthusiastic. He shared all that he was learning with the staff of the Counselling and Care Centre, and I was there to actually witness the transition of the Counselling and Care Centre taking on a very clearly family systemic approach to working with couples and families.
We look beyond the individual, okay? Because a lot of times in social work, in counselling, only the individual attends, or if nothing else, it's just a couple. Okay, but we need to look beyond that, because the individual is influenced by a lot of other factors, by culture, by race, by education, by late grandmother, late grandfather, okay, by friends whom you do not see, by their earlier relationships, being raised by nannies, by even their pets, okay? Yeah, okay, and all these have influence on the individual. So when we think about counselling or social work, okay, we need to look beyond the individual. We need to look at the influencing factors.
I think CCC, since the time of becoming, has always upheld the tradition of the writing, especially I think through Anthony Yeo, who is a very prolific writer. He believes that through writing he can communicate ideas. Through writing you can capture experiences, in the way of sharing with the general public on mental health, relational health, on marriage, on trauma issue that has been quite popular even among readers in that way.
The counselling practice of the Counselling and Care Centre is grounded in the simple philosophy of respect and honour, respecting individuality and honouring diversity. As counsellors, we are dedicated to creating a safe space for people to share their struggles and touching them with compassion and understanding in order to bring healing and renewed strength. The purpose of counselling is to help people to discover and tap on their inner resources for growth, learning, and move on with a renewed sense of hope.
Counselling had benefited me a lot, especially for closure after my mom's death. It helped me to gradually remove all the pain, and I'm glad that I came here for counselling because I found a friend with Ruth. She had walked me through the darkest moment, and I'm very thankful that indeed it helped me over the years because I'm still battling the illness, and it made my recovery process a smooth one.
Counselling and Care Centre also provides consultancy and training dedicated to advancing the counselling profession through the enhancement and development of the practitioner's clinical competency.
The CCC supervisor will sit in our reflecting team also. They will give some feedback. Then after that, during the debrief, they will give us more input on how the case is being analyzed, or what we could do differently to better assist the client in the future. They not only give us input, but they also try to get our input to see where we are, and sometimes they also give us some theory or framework that we can use for the case.
I attended firstly the Master of Science in Family and Systemic Psychotherapy, as well as the Diploma in Clinical Supervision. One of our core services is casework and counselling, and that was the area that I feel most useful in terms of what I had learned from CCC. And I also do a lot of supervision work with my staff. Definitely what I learned from the diploma course enhanced my skills and competency as a clinical supervisor.
One of the things about systemic ideas is helpful in allowing the practitioner engage with the logic of the patient better or a lot more, because it kind of, on one level, it pushes you to think about what is the logic behind the patient or the family's thinking about the situation. It pushes you to engage keenly how they make sense of their own situation, and there's a lot of work to be done in terms of how they perceive their illness, how they think about their own illness, how they think about how the illness might have an impact on their life, and how that influence the way they interact with you and all that.
As Singapore crosses the threshold of its Golden Jubilee, is experiencing unprecedented shifts in its social and political issues. While we move beyond the bread and butter needs, our community issues are becoming more complex. Social trends such as single-parent families, blended families, as well as aging population pose new challenges, demands, and stresses on our families. Moving forward, the systemic approach to policy thinking, social work and counselling practice will remain as relevant and even more crucial today as it has been in the past.
We aim to be a leader in family therapy, training, and research.
We hope to be a voice of care and compassion in the community.
We hope to create a safe and inclusive space for everyone.
Our services will be accessible for all.
CCC will continue to collaborate with partners to make a difference in the lives of people.